Hi, this is Mike Latosky with Discovery Benefit Solutions, and welcome to the Genesis Healthcare Partners MSO Benefit Program presentation for benefits effective January 1, 2014. We're going to spend about 15 minutes covering the highlights of the program, and then have at the end of the presentation some contact information available for you if you have questions afterwards. So with that, let's get started. The agenda is pretty packed, you'll see. So, but I'm going to move through this very quickly. Once again, in about 50 minutes, we're going to cover the physician and hospital networks that are going to be used, the health plan administration, cover some specific on the medical benefits, the pharmacy benefits, dental, vision, and so forth. So we'll go through this whole agenda in about 15 minutes. And once again, if you missed anything, don't worry. We've got some contact information for you at the end of the presentation if you have questions or concerns. First thing is who's eligible. MSO full-time employees working 30 or more hours per week are eligible. Their spouses and domestic partners are also eligible, as well as children up to age 26, regardless of student, marital, or dependent status. Talk a little bit about the network. We're going to be utilizing the Cigna PPO network for the EPO and HSA plans. We're going to give you some information on the benefits here in a minute, but the network, the Cigna PPO network, is one of the largest PPO networks in the United States. It provides access to doctors and hospitals nationwide. There's no primary care physician designation required. You have direct access to specialists, and once again, it's the network used for both the EPO and HSA plans. How do you find your doctor or hospital? Well, it's very simple. You go to www.cigna.com, click on Find a Doctor, then click on the drop-down menu Doctor or Hospital that you're interested in. Select the search type, for example, by using provider name, then address, city, state, or zip code. You can find your physicians that way. And then you also want to confirm that provider or hospital is contracted with Cigna's PPO network. Cigna has a number of different networks, so just confirm at the end there for the drop-down menu that they're a provider in Cigna's PPO network, and you're all set. Who administers medical plan? Healthscope Benefits will become a name that you're very familiar with. It will be on your ID card once you receive it, and Healthscope Benefits is the third-party administrator for the plan. Healthscope can answer any questions about your plan, the benefits, help you with claims, order ID cards, check eligibility, find providers, and much more. If you have any questions, they're available via customer service Monday through Friday, 7:30 to 4:30 Pacific Standard Time at 800-580-8408. You can also go to their website, www.healthscopebenefits.com, for more information on your plan. Let's talk about the EPO plan, medical highlights real quickly. With this plan, there's no deductible. Preventive care is covered at 100%. For Genesis imaging, we reduce the copays. So for a CT scan, for example, you're going to have lower copays utilizing the Genesis facility than if you go outside Genesis. Doctor visits, $25 copay for primary care physicians or specialists. If you go to urgent care, that's going to be a $50 copay. Emergency room copay is $250. That's waived if you're admitted to the hospital. And hospitalization is a $1,000 copay per admission. Out-of-pocket maximum is $3,000 for a single, $6,000 for a family, and there's unlimited lifetime maximum benefit with the EPO plan. The HSA, or Health Savings Account, compatible high deductible plan. First off, Genesis Healthcare is going to contribute $100 a month to your HSA account, and you can get help setting up that account through Human Resources. Once that account is set up, $100 per month will be placed on it, by Genesis Healthcare. The deductible for this plan is $3,000 per person, $6,000 per family. Preventive care, once again, is covered at 100%. Then for doctor visits, after you meet that $3,000 deductible, benefits will be paid at 20% in-network or 50% out-of-network. Emergency room, after deductible, once again, 20%. That's in or out of network. Hospitalization, after the deductible, you pay 20%. The plan will pay 80% of the cost. If you go in-network, it's 50-50 out-of-network. And then the out-of-pocket maximum in-network for the HSA plan is $5,000 for a single, $10,000 for a family. and the out-of-pocket maximum if you're going out of network is much higher at $10,000 for a single, $20,000 for a family. A little HSA information. What are the advantages of an HSA plan? Health savings account is where you can set aside money on a federal pre-tax basis to help you pay for health care expenses and meet deductibles. Another advantage is any unused balance in your health savings account gets carried over from year to year, so you never lose it, and you can take the account balance with you if you leave the company. In 2014, the IRS health savings account contribution limits are set at $3,300 for a single and $6,550 for a family. And if you want more information on HSA accounts, you can go to the IRS website that's listed there, or we would suggest you consult a tax professional. The prescription benefit program for the EPO plan covers for a $10 copay generic drugs, 30-day supply, for a $25 copay brand name drugs, once again 30-day supply, and a 30-day supply of non-formulary brand name drugs covered at $60. With the prescription benefit program, you have a 90-day mail order benefit. For 2 copays, you can get a 90-day supply of your maintenance medication. Or we have a retail 90 benefit, which allows you to pick up a 3-month supply of your maintenance medication at your retail pharmacy for 3 copays. Specialty drugs are covered at 30% up to the $100 max per prescription. And more information about your pharmacy plan and formulary can be you can find at www.welldynrx.com. The prescription benefit for HSA plan is very similar. Your copay for a 30-day supply is after the deductible is met. So after that $3,000 deductible is met, then you would receive for a $10 copay your generic drugs, 30-day supply, $25 copay for brand name medications, $60 for non-formulary brand medications, and then same mail order program, retail 90, and specialty drug benefits available through WellDyneRx once again. We do have a cash in lieu program available at Genesis Healthcare, so if you decline your company benefits, the Genesis benefits, and have other group coverage, Genesis Healthcare Partners will give you $100 a month as cash in lieu. Other group coverage does not include TRICARE, Medicare, or individual insurance policies. And then please see HR for the cash in lieu form to complete that form. Your dental options. United Concordia is our dental provider. We have 2 plans, a DHMO plan or a PPO plan, so you're going to choose one or the other. Highlights of the DHMO plan that affords low affordable employee premiums. There are no deductibles or plan maximums to worry about. There are fixed copays for covered procedures, and you must select a primary care dentist, so you must sign up for a dentist when choosing this plan. And you can see some of the copays for office visits and crowns and orthodontics and such right there. For the PPO plan, you don't have to select a dentist, but if you stay in network, you're going to receive a stronger benefit than if you go out of network. So in network, as without a network, there's a $50 deductible for single, $150 for family. Both in and out of network, there's a $1,000 per person annual maximum. That excludes preventative care. Preventative services are covered at 100%, no deductible. Basic services are covered at 80% after the deductible, whether it's in or out of network. And then major services are covered at 50% after the deductible, but do want to highlight that there's a 6-month waiting period if you do not have what's called credible coverage. If you're not currently enrolled in a credible plan, when you come to the Genesis plan, you will have a 6-month waiting period for any kind of major services. And then if you go down below for orthodontia, there's also a 12-month waiting period for orthodontia if you don't have credible coverage or continuous credible coverage. The orthodontia benefit is 50% to a lifetime maximum of $1,000, and that's a separate from the annual maximum. So they're 2 separate maximums. So those are your United Concordia DHMO and PPO plans. If you would like more information, you can go to the United Concordia website at ucci.com and print forms, find a dentist, print ID cards, all kinds of great stuff. Also, customer service down at the bottom there is available at 866 800-357-3304 for DHMO or 800-332-0366 for PPO. We do have a vision plan offered as well to employees through VSP. In-network, eye exams are going to be covered at $10. Out-of-network, you get an allowance of up to $45. You have a material copay of $25 in-network. Single, bifocal, trifocal lenses are going to be covered at 100% if you stay in-network at a VSP provider, up to $30, $50, $65 if you go out-of-network. Frames are covered up to $130. Anything over $130 for your frames you're going to pay, but up to $130 the plan will pay, and then up to only $70 if you go out of network. Contact lenses are covered up to $130 if you want contact lenses in lieu of glasses, and if you're in network, up to $105 out of network. Exams are covered every 12 months, frames every 24 months, lenses every 12 months, and lenses are covered 100% after the eye exam copay for a single, line bifocal, trifocal, or progressive lenses. And progressive lenses are extra, I'm sorry. More information available at vsp.com or 800-877-7195. So group life and AD&D insurance is offered through the Hartford. This policy is a $50,000 life, accidental death, and dismemberment benefit, and premiums are paid by Genesis Healthcare. Additional life insurance may also be purchased for employees, spouses, domestic partners, and children. And please contact Human Resources if you're interested in purchasing more additional life insurance. Long-term disability is also a program that's paid for by Genesis Healthcare. The long-term disability program covers you in case you're deemed disabled caused by an accident or sickness away from work, and it will cover you after a waiting period of 360 days, up to a monthly maximum of $3,000 per month. More information available also through Human Resources or by calling Discovery Benefit Solutions. Value-added programs available through the Hartford. There's a travel assistance program, ID theft resolution program, beneficiary assist counseling services, and ability assist EAP. So all kinds of great programs that are value-added from the Hartford for participating in the group life and long-term disability programs. More information on these programs can be found at hartfordlifeconversations.com or by contacting Human Resources or Discovery Benefit Solutions. We have a great employee assistance program available through Aetna. There are 8 face-to-face confidential sessions per employee and household member per issue per year. If you're having issues at home with marriage or family conflicts, substance abuse, financial and legal services, or stress management, just to name a few, you can call the employee assistance professionals at Aetna and receive, once again, up to 8 face-to-face confidential sessions. There's a 24/7 crisis hotline available at 800-342-8111. There's also more information available through the Horizon Care Link website. It's user ID GHP, password EAP. Just to highlight once again, we do have a flexible spend account available through Discovery Benefits. This program resets every April. So in March, you'll be able to sign up again for an April through March effective date. And for if you're interested, you can set aside through this program, set aside up to $2,500 on a pre-tax basis to pay for medical, dental, vision expenses not covered by the medical, dental, or vision plans. Examples of those expenses will be co-pays, co-insurance, anything left over from that's not covered by the plan, you would be able to run through, for the most part, through the flexible spending account and use pre-tax dollars to pay for those cost items, which is a great deal. Go to discoverybenefits.com, not to be confused with discoverybenefitsolutions.com, or to Genesis Internet site for a list of eligible expenses. There's also a debit card available and direct deposit from your paycheck into the FSA account. Dependent care reimbursement is also available up to $5,000. So if your child is going to a licensed daycare provider, You can pay for that daycare costs with pre-tax dollars through the Dependent Care Reimbursement Program. The IRS does have a use it or lose it provision, which means any money you do not use during the plan year is lost, so be conservative when planning. A little information about healthcare exchanges, which is new for 2014. Covered California is California's new health insurance exchange, where individuals, families, and small businesses can find affordable health insurance. The plans have different levels of coverage, platinum, gold, silver, bronze, with no medical underwriting. And open enrollment started October 1st and runs through March 31st of 2014. Plans are effective January 1, 2014. I wanted to note that as a Genesis Healthcare employee, you will not be eligible for any healthcare subsidy if you choose to enroll in these plans. More information is available at coveredca.com or 800-300-1506. Your pre-tax medical contributions for January through December of 2014 are as follows. For the EPO plan and HSA plan, no contribution for employee-only coverage. $144.60 for the EPO plan, or $67.80 if you're covering yourself plus a spouse or domestic partner. $105.20 or $39.33 if you're covering yourself plus child or children. And $263 or $153.23 per paycheck if you're covering yourself and your family. For dental and vision contributions, January through December of 2014, for United Concordia PPO coverage, it would be $22.28 per paycheck, $8.49 for the DHMO, $4.16 for the vision plan. Employee plus spouse or domestic partner, that's $45.35 per paycheck, $16.98 for the DHMO, $7.12 for the vision program. Employee plus children for the PPO is $49.49, $17.23 for the DHMO, and $7.27 per paycheck for the vision program. And then employee plus family is $82.97 per paycheck for the PPO plan, $25.75 for the DHMO, and $11.72 for the VSP vision program per paycheck. Now, what do you need to enroll in benefits? First, you need to complete the enrollment form for the Cigna Medical Plan, United Concordia Dental Plans, and VSP Vision Plan. If you're enrolling in the HSA or Health Savings Account, there's additional paperwork that must be completed to sign up for an HSA account, and Human Resources has that paperwork, so ask them. If you're interested in the Cash in Lieu program, if you're declining benefits, you must complete a form that's also available through Human Resources. And return your completed enrollment forms, Cash in Lieu form, or HSA information to Human Resources within 31 days of the date you are eligible to receive benefits. Please see HR for forms on the company internet, and please notify HR of any life event or changes during the plan year within 31 days of the event or change. If you have questions, please give Discovery Benefit Solutions a call anytime. We're here to help. Carla Gibbons is your assigned account manager, and she can be reached at 619-704-3519 or carlag@discoverybenefitsolutions.com. Thanks for your time, and welcome to the Genesis Healthcare Employee Benefit Program for 2014.